The United States is often described as a global leader. Just last year, we spent $997 billion on defense, more than the next 9 countries combined. We lead the world in scientific research, producing more Nobel Prize-winning work than any other country. And with a GDP surpassing $30 trillion, the United States commands the largest economy on planet Earth. Yet last year, 25 million Americans went without health insurance, 41% of adults had medical debt, and roughly 2/3 of US bankruptcies were caused by medical bills. But the reality is, this isn't a new problem.
The Declaration of Independence is an incredibly important and profound philosophical text when it says that all men are created equal, they're endowed by their creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. They're not offering a complete list of basic rights. They didn't at the time have an understanding of the kind of institutional scale that healthcare has now reached that was not imaginable to them, but there certainly was an invitation to people to think about what do count as basic rights.
No, people don't have that right today. Case of David Bell, who died of COVID pneumonia, and he actually expired in the parking lot of a satellite hospital of Barnes-Jewish. No investigation as far as I'm aware. He was refused admission to the hospital 3 times.
America's modern attempt to expand healthcare access was the Affordable Care Act.
After all the votes have been tallied, health insurance reform becomes law in the United States of America.
Passed in 2010, the ACA expanded coverage through Medicaid and private insurance marketplaces, while banning discrimination based on pre-existing conditions. But expanding coverage didn't guarantee care, and for millions of Americans, access remained uncertain.
Because the Unaffordable Care Act has been a disaster.
Obamacare did not do what was promised. Everybody can acknowledge that. As I mentioned, premiums are up 60% since it became law in 2010.
Just because you have Obamacare doesn't mean you have access to care.
Partisan politics aside, the Affordable Care Act revealed something deeper. Legislation alone can only go so far in a system shaped by structural limits. It's clear the change needs to come from somewhere else. First, if healthcare only begins after someone gets sick, the system has already failed. In fact, the best interventions often happen earlier.
But somewhat controversial idea that let's provide access to clean syringes to people who are injecting drugs so that they don't get HIV. Policymakers were also worried some people may start using drugs. The percentage of HIV/AIDS among people who have now increased access to clean syringes went down by 33%, and there was no increase in drug use.
Second, for millions of Americans, healthcare is often just too far away.
Pretty much anything that can be done in a brick and mortar office can be done on our mobile unit. Somebody does have a place to go within 15 minutes. They don't have to go 1 hour to see a healthcare provider.
Third, illness begins in people's lives long before they enter a hospital. The best healthcare system sees the patient as a person.
It's easy to say, you're on your own, that's your problem. But illnesses have social and natural and self-caused components. Then we have to say that society bears a good bit of responsibility.
It's more of the, let's help them find housing, let's help them secure transportation so that the anxiety decreases and we're not over-diagnosing or over-medicating.
Fourth, health systems improve when they know what they're producing. Targeting just a few critical outcomes can improve the health of entire communities.
And so if we look at cancer rates, we look at heart disease, we look at stroke, we even look at a whole variety of other conditions. If we do a better job, we see the outcomes of all those conditions later in life dramatically better.
And finally, healthcare only works when patients trust the people giving it.
It's okay to use medical language so that the patients understand the diagnosis, but you should also use language where they can understand what that means.
Just really getting to know people, meeting them where they're at, and seeing what it is that they actually need.
Giving them that time, but to see you as someone who actually cares about their health, their family situation, and their outcomes.
Of course, none of these changes happen individually, but they depend on everyone to build a better healthcare system. As the United States approaches its 250th anniversary, it's unlikely we'll declare a constitutional right to health, at least not on paper. But history reminds us that rights in this country are never delivered all at once. The right to health must be realized through physicians, hospitals, social workers, mobile clinics, public health officials, academicians, and critically, the community. The founders never intended for the Declaration of Independence to be merely an ask of government. It called upon the citizens, such that when the status quo threatens life, liberty, or the pursuit of happiness, we ought to respond. Because every grave here marks a life that was once walking through a door. And the measure of our nation, 250 years in, is whether fewer people have to walk through that door at all.